Hello, my name is Amy Klezak, and I'm a nursing student at the University of Michigan. I'm going to present a patient to you. Background data. Patient is a 19-year-old Caucasian female and is currently a student at the University of Michigan. Patient's marital status is single. Patient's usual source of medical care is her primary care physician in her hometown. Vital signs are as follows. Patient's heart rate is 62 beats per minute. Patient's blood pressure is 116/68. Patient's respiratory rate is 14 breaths per minute. Patient's temperature is 99.1 degrees Fahrenheit taken orally. Patient's chief complaint is frequent migraines. History of present illness. Patient reports that the onset of her frequent migraines was in 2010 when she was 12 years old. The usual location of the migraines is on one side of the head, and the pain it presents is pulsating. Patient reports that on a day she gets a migraine, it will last 6 to 8 hours, or from the mid-afternoon until the time she goes to bed. Patient rates the pain of migraines between a 5 and a 7, depending on the day. Patient states that she gets migraines about once a week. Patient reports aggravating factors such as strong sense, stress, and lack of adequate water consumption. Patient reports alleviating factors as sleep and taking Excedrin migraine. Patient tried multiple different prescription migraine medications in the past, but reports that Excedrin has helped the most. Associated symptoms the patient has with migraines is lightheadedness and occasional nausea. Patient reports that the migraines interfere with many of her daily activities, including studying and exercising. Patient's perception of the migraines is that if she is less stressed and stays hydrated, the migraines will cease or occur less frequently. Health history. History of chronic illness. Patient was diagnosed with exercise-induced asthma at age 10, but her asthma started occurring without exercise when she was 15 years old. Patient was also diagnosed with a physiologic heart murmur at the age of 7, but did not need any treatment for it. Patient was diagnosed with sinus bradycardia at the age of 14. Patient was diagnosed 3 months ago with anxiety. Immunizations. Patient is up to date on her immunizations, but denies ever receiving flu shots. Allergies. Patient is allergic to sesame and has no known drug allergies. Hospitalizations and surgery. Patient has never been hospitalized or had surgery. Current medications. Patient is prescribed to Zoloft for anxiety and Aviane birth control. Patient reports taking Excedrin migraine as needed and usually takes 2 pills containing 250 milligrams of acetaminophen, 250 milligrams aspirin, and 65 milligrams caffeine when she has migraine symptoms. Functional assessment. Patient reports consuming 3 alcoholic drinks once a week socially. Patient denies the use of recreational drugs. Patient exercises 1 hour every 2 weeks. Patient states that she sleeps 8 hours per night and takes a 2-hour nap once a week. Patient reports that she doesn't eat a lot of vegetables, she snacks frequently, eats pasta daily, eats fruit, and thinks the amount of food she eats is sufficient. Patient denies smoking cigarettes or cigars. Patient doesn't consume beverages with caffeine, but takes 65 milligrams of caffeine that is contained in her Excedrin about once a week when she has migraines. Psychosocial data. Patient states that her family has a close-knit dynamic. Her parents are married, and she has a good relationship with her 2 older siblings who are graduated from college. Patient reports good interpersonal relationships with both her friends and her boyfriend of 7 months. Patient reports her only environmental hazards are living in close quarters with other students who are sick frequently and poor circulation of her dorm. Patient states that her family is not very spiritual and denies attending church. Patient's current educational level is a freshman in college. Patient reports stressors as grades, maintaining social relationships, staying healthy, and missing her family. Patient's pattern of healthcare has changed after she came to college. She used to see her pediatrician yearly for a sports physical, but now plans to only see a doctor when sick or when experiencing health problems. Family history. Patient's father, brother, and sister are diagnosed with anxiety. Patient's father had skin cancer. Patient's maternal grandfather is believed to have died of a heart attack. Patient's paternal grandmother has alcoholism. Due to my patient's current and past history of migraines, I will be conducting a head, eyes, ears, nose, and throat exam. Review of systems. Patient reports migraines once a week that occur with dizziness, lightheadedness, and occasional nausea. She reports that she does not have a precipitating aura or vision changes with her migraines. Patient denies any other pain of the head, eyes, ears, nose, and throat other than her migraines. Patient denies any vision changes and does not wear corrective lenses or glasses. Patient reports that her hearing is similar to her friends and families, but reports that sometimes it sounds like people are mumbling when they are speaking to her. Patient states that her last eye exam was about 4 years ago and her last dental exam was 1 year ago. Patient denies noticing any voice hoarseness. In the past school year, patient reports having a cold 3 times and having strep for the first time in 5 years within the past month. Patient reports only having a sore throat when she has colds or strep. Patient denies any neck pain or tenderness. Physical examination. Patient's skull and head have normal size and shape for her age. Her head is midline and there is no swelling around the eyes or lesions and pigmentation changes. Patient has full range of motion in the neck and has no tenderness, bumps, or pain of the cervical vertebrae. Patient's trachea is midline and does not have trouble swallowing. None of the patient's 9 cervical lymph nodes are swollen or enlarged upon palpation. Patient's eyelids have no lesions, redness, discharge, ptosis, and patient has equal eyelash distribution. Patient's conjunctiva has small blood vessels, sclera is white, and cornea is clear. Patient's lacrimal apparatus has no discharge or tenderness. Patient has no peripheral vision loss and has 20/20 vision. Patient's extraocular eye muscles function properly. Corneal light reflex test shows that light reflects on the same place of the cornea in each eye. Patient's eyes do not deviate with the cover-uncover test. Patient's pupils are equal, round, reactive to light, and accommodate. Patient's nose is symmetrical and has no lesions or inflammation. Patient has equal hearing in each ear during the whisper, rin, and rubber tests. Patient does not lose balance or sway excessively during the Romberg test. Patient's septum does not deviate. Patient has minor mucus discharge in the left nostril and the right nostril is clear. Patient has minor crepitus in the temporomandible joint. Patient's buccal mucosa is pink and moist, and her gums are not inflamed or receding. Patient's uvula and soft palate rise midline, and tonsils are a +2 without exudate or white patches. Patient's tongue protrudes midline, and she is able to move it side to side without difficulty. Finally, the patient's gag reflex is intact. Due to my patient's asthma diagnosis, the respiratory exam is of high priority. Review of systems. Patient states that her asthma flares up mostly when she has a cold or when there is a change in seasons. Patient reports orthopnea when she is in bed at night. Patient states that she also gets coughing attacks with the orthopnea, and it gets better when she sits up or she forcibly stops herself from coughing. Patient reports vomiting during some of the coughing attacks. Patient was on her high school swim team in high school and reports fainting twice when having coughing attacks during practice. Patient reports that cough is dry and only coughs up sputum when she is sick. Patient denies painful breathing, but does report difficulty breathing. Patient reports that she coughs and wheezes with a lot of strenuous exercise. Physical assessment. Patient's thorax is free of deformities, injuries, and is symmetrical. Her skin has pink undertones and is consistent with the rest of her body. Patient's AP transverse diameter is a 1:2 ratio with no indications of barrel-chestedness. Patient's respirations are even, regular, and coordinated, with no signs of distressed breathing. Patient's breaths are not excessively deep or shallow. Patient's chest expansion is smooth and even on both sides. Patient has present tactile fremitus that decreases lower on the back. The ribs and thorax are aligned symmetric without masses, crepitus, deformity, or tenderness. Patient's vesicular sounds are soft and inspirations are longer than expirations both posteriorly and anteriorly. Patient has minor crackles in the lower lobes of both right and left lungs. Patient has no other adventitious sounds such as wheezes or rhonchi. Patient has normal findings for bronchophony, egophony, and whispered pectoriloquy, which all indicate that there is no consolidation of the lungs. Pertinent systems. According to an article by Lee, it is important to also assess the cardiovascular system because the heart and the lungs work together to provide oxygen to the body and can both cause breathing problems for patients. Also, because of my patient's history with cardiovascular diagnoses, the cardiovascular system is an essential pertinent system. Patient was diagnosed with a physiologic heart murmur at the age of 7. Patient reports visiting a cardiologist once a year in high school because her primary care physician had a worry about her slow heart rate. Cardiologist diagnosed patient with sinus bradycardia and an irregular heartbeat, probably due to good physical fitness. Patient reports not seeing a cardiologist in 1 year. Another pertinent system to examine would be neurological, based on my patient's history of migraines. According to an article written by Dagny Hall and Mark Oberman, published by the National Institutes of Health, headaches are the most often reported neurological symptom. Also, the article mentions that neurological exams are important to understand the pathology of migraines and possibly find any underlying factors. This completes my assessment. Thank you.